Kia ora, good evening. Labour's Commerce spokesperson Clayton Cosgrove has been left wondering when is supplementary order paper to protect subcontractors when companies like Mainzeal collapse will be adopted as part of the Construction Contracts Amendment Bill. His concerns come now that the Minister in charge of the legislation, Maurice Williamson, has resigned. Mr Cosgrove was in the city consulting with contractors and subcontractors when Mr Williamson's resignation over an ill-conceived phone call to police came earlier today.
Maurice Williamson is in charge of the Construction Contracts Amendment Bill. We've put up a supplementary order paper to assist to make sure that the money that's paid to subcontractors actually gets to subcontractors, so it's safeguarded. Maurice is now gone, so will this delay the bill? I hope it doesn't. But you've got strike one Judith Collins, strike two Maurice Williamson. Who's next? I mean, when is this going to stick to John Key? When is John Key actually going to stand up and say that his government and his cabinet is rotten? When is he going to enforce these so-called higher standards that he said he would when he became Prime Minister? How many ministers have to tip over before John Key will actually take some action? And as I understand it, Mr Williamson's giving up his $250,000 salary and being reduced to $150,000 and staying here till the election.
It is up to the public though. I mean, those poll results, they tell the story, don't they?
Well, the poll results, if you've got to analyse the poll results in terms of the left-right bloc. If you add up the National Party and the mad, the bad and the sad, the Conservatives and others who they're going to leap into bed with, and you add up the bloc on the left, then there's only about 4 or 5 points in it. That's actually how MMP works.
Let's talk about the changes you want to see to the legislation. Who are you protecting and how?
Well, since the Mainzeal collapse, and before then, we've known that subcontractors, the guys actually on the tools, the small business people who often their cash flow is job to job, are the guys that are sort of the last cab in the rank to be paid out. And what happens now is the developer pays the lead contractor and then he divvies out the money to the subcontractors. If the lead contractor, as Mainzeal did, goes bust, all that money is captured. Guys of subcontractors have done work, they're not paid out. We're proposing what the New South Wales government has put in place, which is, if you like, which is like a trust. So you put in an extra step, doesn't interfere with any contractual arrangements, does not interfere with cash flow, does not resolve disputes, doesn't interfere with any commercial independence, so that the developer pays the money in the same way, the first of every month, or whatever the contract says. Developer pays the money to the trust, independent. It pays it out to the subbies and to the lead contractor, and if the lead contractor goes bust, that money is captured in the trust and is ring-fenced from the receiver. At the end of it, the project, if monies are retained as a guarantee of work, at the moment they're retained by the lead contractor. If the lead contractor, as Mainzeal did, goes bust, money gone, we say that money should be retained within the trust. But I want to make it clear, this is for commercial, industrial, big projects. Mum and Dad want to build a house. We're not going to say to them you must have a trust, but for that big end of town where the major problems are, then this will guarantee that subcontractors will be paid for the work that they have done. And it's pretty simple, there shouldn't be any politics in it. We've put a supplementary order paper up to the current bill. Maurice isn't there now. He said there was no problem. He then said he was going to look into it once we decided and announced that we were going to do work on this. He's now gone. I would hope that the incoming minister, we could reach across the aisle and say, hey, this is about protecting people and ensuring they get paid for work they do.
In 2006, the Invercargill Licensing Trust, in conjunction with St John's, distributed 55 portable defibrillators to businesses and organisations around the city. The initiative has been ongoing, with the number donated for emergency use now at 70. Today, Crow and Horworth staff were familiarising themselves with the unit and its correct operation. We've all seen them on the wall at venues and businesses around the city, but how many of us actually know how to effectively deploy a potentially life-saving defibrillator effectively? Paul Colvin spends his days ensuring as many as possible carry that life-saving ability within the community.
In conjunction with changing pads and batteries, which is done usually every 3 years, the ILT gives the city a chance to come back and revalidate in the use of a defibrillator. So those courses are available and they really are used quite a bit, yeah. We've given them a defibrillator because of the amount of people that are in this area here, and because of your batch next door, you've got the WHK, so this particular building has a lot of people at any one time. So it's really good for these people to have the knowledge and the know-how to use defibrillation, because it's most important.
Crow Horworth housed the defibrillator, but it's for the use of all in the immediate area should an emergency occur.
Yes, it is very important, and hence why we place a very big importance here on training our staff so they're able to administer CPR through to clients, staff and surrounding community. Definitely encouraging people to train and learn from St John and go to their training seminars they have and get skilled up on these defibrillators.
It actually stops the heart. Most people believe that it kind of keeps the heart, or re-kicks the heart, but what it actually does is it stops the heart, so it allows your own AV node to come back and perform its own area. It's like if your heart was in erratic sort of area, which is ventricular fibrillation, it sits there and shakes. So what we need to do is we need to give it a shock to bring it back into reality. It doesn't always happen on the first shock, might happen on the third shock, might happen on the fourth, so we can't really guarantee when that would actually happen.
The operation of defibrillators was previously solely the preserve of a medical professional, but today, with the arrival of new highly portable units, the ability to save lives through their use is now community-wide. If a defibrillator is not immediately available, then knowledge of CPR is a must.
There's nothing worse probably than going to a place in the city where people haven't even started to do CPR. So our ambition is to get every person in the house knowing how to do CPR. Even if that's all they do till the fibrillation arrives, that's our main objective.
We update our staff on a regular basis to make sure they're well equipped to deal with any emergency.
Has there been one yet?
No, there hasn't, thankfully.
But good to be prepared.
Yes, good to be prepared indeed.
As well as the 70 defibrillators made available through the ILT St John's initiative, a further 60 have been installed in businesses, clubs and community facilities around the city. Hunter Andrews, South Today News. A series of special art workshops were held at the Southern Institute of Technology this week. The workshops were organised by the Murihiku Māori and Pacifica Cultural Trust along with the Tautai Contemporary Pacific Arts Trust from Auckland. There were 20 educators from early childhood, primary, secondary, plus established artists involved in the workshops, with work exhibited and acknowledged at a presentation last night. The workshop's artists were Nikki Hastings McFall, an internationally acclaimed artist who works in mixed media, and Lonnie Hutchinson, who is also an internationally acclaimed artist who is currently working on a project as part of the Christchurch rebuild. After the break, healthcare workers slow to take up a free flu vaccine offer and score holiday fun and games at the new stadium Southland. Welcome back to South Today News. For the third year in a row, distribution of influenza vaccines has topped over 1 million, and with 3 months to go in the 2014 influenza program, it's hoped another 250,000 doses will be taken up. The vaccine is free to those most at risk, including pregnant women and those with health problems, but one group, healthcare workers, have been slow to take up the free flu vaccine offer, putting themselves and potentially others at risk.
The influenza vaccine is changed yearly according to what strains of viruses are circulating, and New Zealand contributes to a worldwide system of viral surveillance where patients with influenza have swabs taken and the virus is looked at in detail, and viruses are, as you know, change from year to year. So the vaccine is made up of the currently circulating viruses, and a vaccine is made for the southern hemisphere each year, and then another one is made for the northern hemisphere, and that's all done through the World Health Organization. I think if you talk to anyone who's had true influenza, they'll all tell you it's a horrible disease. It's not like having a cold, it's significantly different. It's that sort of viral disease that gives you aching muscles and sore head and fever, and you just feel like you've been hit by a train, and it lasts for often a week or 10 days, and it is a significant serious illness that you really don't want. People should seriously consider getting influenza vaccine, even if they're well and healthy. not only does it take you out of your normal work and life for a good week or two, but if you get influenza, you put other people at risk as well. People with influenza don't normally get tested for what type of influenza they've got, so we don't necessarily know what each person has, apart from those surveillance systems that I talked about. But we do know that there's some H1N1 around, and people can be protected from it if they get vaccinated with the current seasonal vaccine.
Also, healthcare workers are at great risk of being infected. How is the uptake going with vaccinations there?
Well, that's an interesting question, Margot. We're usually disappointed at the immunisation uptake for influenza amongst healthcare workers. At the moment, we're sitting between 40 and 50% of our DHB staff taking up the free vaccination that's offered to them. We would prefer that to be much, much higher, and we do encourage staff to have the vaccination. You're quite right to say that they're at risk because of the exposure to sick people within the hospital, but also they pose a risk. If they do come down with influenza, they pose a risk to all the patients as well, and so it is a very responsible thing to do for healthcare workers to get vaccinated with the seasonal flu vaccine.
So you have a target this year of getting 60% of healthcare workers vaccinated. Is this realistic?
Well, that's a small step. I think we're taking small steps at a time. Ideally, we'd like it to be much higher than that. But yes, we've got a target of 60%.
School holiday activities are keeping children entertained in the south, and there's plenty of action to keep bodies busy at Stadium Southland this week. Sports Southland offer a holiday program with a range of 17 sports for the younger generation, including touch, volleyball, football and hip-hop, which children are able to attend for up to 4 days. Stadium Southland's new clip and climb rock climbing wall and cycling in the velodrome have proven to be very popular with kids. 120 children will attend this week's program before Sports Southland take it mobile with rural programs in Winton and Riverton. Yet another MP is using the parliamentary recess to get out to the regions. Green Party Industrial Relations spokesperson Denise Roche. I asked the visiting List MP about key issues for her and her party this coming election.
Well, one of the things that we're really keen on doing is addressing inequality, and that really, as well, of course, as we've got to step up around the environment and put some measures in place around climate change.
This government isn't doing that?
Not around climate change, it's not, and certainly not around inequality. One of the things they've introduced quite recently is the Employment Relations Amendment Bill, which reduces the ability for workers to negotiate collectively, reduces union rights, removes the right for a tea break even. So it takes us back to a time of individual-based bargaining. They've already introduced youth rates, they've introduced 90-day trials, and when workers are starting out in jobs, that means that they're not in a position to be able to negotiate decent wages, which overall drives wages down. What we'd like to see is good, healthy employment relationships, and to do that, workers need to be empowered to be able to talk with the employers.
Are there really that many employers who would deny their workers access to a break or a tea or lunch break? They certainly aren't going to hang on to those employees long, are they?
Well, it was really interesting. We had something like 15,000 submissions on this bill. I don't think we got many employers who said, yeah, we want to get rid of the right to have a tea break. Again, it's kind of the government using a sledgehammer to crack a nut. There was one case in the last 10 years which was about an air traffic control worker who couldn't get a tea break under the law, and this is about that one particular case, and it's just crazy.
I guess your natural coalition partner is Labor, although they're failing to confirm any sort of pre-existing relationship before the election anyway. What do you have common ground with them in your areas?
Yeah, we definitely do. I've got the industrial relations portfolio. They're very strong, of course, on unions. That's where the Labor Party came from. So we've got a lot of commonality there. They're also very good around social justice issues, and that's great. Where we do differ And we are independent political parties. Frequently where we differ is around the environment.
Well, that's all from us for this Thursday night. Sports is up next from the news team. Have a very good night.